Welcome to the fifth video of my OET course. It's going to be about the speaking part. It's part of the free OET course that you need to score high in your OET exam. Let's begin. This video is going to have 6 parts. Layout of exam. We'll understand the role-play cards, all the resources that you need, phrases to score high. We'll understand the assessment criteria. And at the end, we'll practice with AI. You don't need anyone else to practice with you. In the speaking subtest, you will have total time of almost 20 minutes, and there will be 2 role plays. The role plays are profession specific, means doctors and nurses have different role plays. The preparation time for each role play is 3 minutes, and the speaking time for you when you can speak is 5 minutes. So altogether 20 minutes, 3 minutes for each role play to prepare, and 5 minutes for you to speak. During the test, there will be 2 cards, candidate card and role play card. Get to see the candidate card. Interlocutor or the role player will see the role player card. This test is facilitated by an interlocutor who will take the role of the patient or the carer of the patient in each role play and will record the role plays. And remember, interlocutor is not involved in the marking or scoring of the test. When the time is up, the interlocutor will say, "Thank you." That is the end of the first role play. Once you're done, the test is marked by 2 or more trained OET assessors using 9 assessment criteria. I'll talk about it in detail. So what skills are tested during the speaking exam? Speaking clearly, fluently, and accurately, using the role play to communicate with the interlocutor, balancing the output with input to demonstrate principles of patient-centered care, using language appropriately, flexibly, accurately for the scenario. As I mentioned before, there will be 2 cards. This is the role play card you cannot see. This is the candidate card you get to see. Here, there will be 3 parts. Number 1, setting, means where you are right now. Just try to imagine you're in this setting. This is a medical clinic. Number 2, background information on the context. Number 3, task prompts. You have to look at these prompts and do the role play. So what resources you need? Here you can see I have official roleplay cards. I got this from OET official website. You have to do them one by one. Then here you have to do 3 really important things. OET speaking guide for linguistics and speaking guide clinical communication. Here we've got assessment criteria. I will talk about it later in detail. I've provided the download link in the description. You can download all these files. Once you open the speaking guide for linguistic criteria, you can see even if you're a speech pathologist, doctor, or a nurse, you've got an audio. Right-click, open in the new tab. There will be an audio that you have to listen, follow the instructions that they have provided, how to answer well and score high. So all the sentences by doctor and interlocutor are discussed in detail. So read this file. If you think this video is helpful, please don't forget to subscribe and like this video. Thank you. Let's continue. It's really important that you understand the assessment criteria. As you can see, in this assessment criteria, they have linguistic criteria, clinical communication criteria. Just now you have read the guide on both topics. In linguistic criteria, you have bands from 0 to 6, and you have to score 5 or above to get B in the subtest. In clinical communication criteria, you'll have bands from 0 to 3, and you have to score 2 or above in each indicator to get B in your speaking subtest. You can read this assessment criteria. I can make it simple for you. I'm not going to read the whole criteria right now. I can just tell you, simply remember what they want to see. They want to see your ability to ask questions, listening actively, giving advice or recommendations, giving explanation, building rapport. All these things are really important for a healthcare setting. To fulfill all these in clinical communication criteria, try to tick all these things when you're speaking. For example, initiate or begin the conversation appropriately. So you just keep doing it and tick it. Try to tick all these things as much as you can. For linguistic criteria, try to focus on your pronunciation, fluency, appropriateness, and the resources of grammar. It's okay sometimes if you think or you stop for a while, but it should not create any disturbance for listening or make the interlocutor feel that you cannot answer. Try to stay above this line. Now let's talk about the phrases that you need to score high. Here I have the file. Just open it. This PDF file has phrases for each part. Introduction, what kind of phrases you should use. Sympathy, history, diagnosis. Let's see. Introduction, you can say, "Nice to see you again." "Nice to see you." Choosing depending upon the patient's first visit or you know the patient. If you don't know the patient, you can say, "Hi, I'm Dr. XYZ. I'm doctor on the duty today. Nice to meet you." And the patient will say, "Nice to meet you too." And then you'll ask, "What can I help you?" and then the patient will talk about the problem. So it's really important that you introduce yourself. And if you don't have to introduce, at least you greet the patient. For sympathy, just try to use these phrases to show that you really feel sorry or you're concerned about the patient. For history, try to ask politely. Let me begin by asking you your opinion. So it's like you're asking patient about history, but not directly. The same way we've got phrases for diagnosis, management, reassurance, the ending of conclusion, and there's really important thing, reluctant patients. Some patients don't agree with what you say. You have to let them agree with what you're saying, or at least understand what you want them to do. There are some special cases sometimes about lifestyle, about exercise, about diet, even sometimes you have to refer to another doctor. So with this file, don't miss any sentence because it's really helpful. And last but not the least, don't forget to watch these two videos on YouTube. I've watched these two role plays and they've helped a lot. These two videos are made by official OET. Lots of people don't know that you can actually practice with AI. Sometimes they have to find study partners online. Now we have AI, we can use it. Simply go to ChatGPT, click on New Chat, click on GPTs, and here type OET Speaking Roleplay. So this one, okay? And click on Start Chat. Here, click on Add Photos and Files and upload any roleplay card that you want to practice. For example, I've uploaded this sample roleplay card, and now you can practice with it. ChatGPT will ask you, would you like to roleplay as a doctor? At the bottom right, click on Use Voice Mod. Now allow the microphone, and now you can begin the roleplay. Here, ChatGPT will also give you a 3-minute timer to prepare. You can prepare your roleplay card. Once you're done with the roleplay, you can ask ChatGPT to give you a score according to OET criteria. That's the end of my OET course. I hope you enjoyed the whole course and learned a lot of new things. I'm not saying that you don't have to use any other online resource. You can also watch other YouTube videos. There are many helpful channels on YouTube like E2 English, OET Official, and OET SLC. You can just watch those videos, get information. If you think my course was helpful, please share with your friends so that everyone can learn for free. What would you like to see in the next video? Please comment below. Thank you.